Hey guys, Dr. Brandan Lee here. I want to address a really common question that we get, and it is this idea that it is dangerous to take vitamin D, or that you can take too much. I can't tell you how many times I've been talking to someone about the benefits of vitamin D, and they say, "Oh, I heard you can take too much of that." And so I want to address this because it is really important. And technically, scientifically, yes, in fact, it is possible to take too much vitamin D. But in a day and age where people are sick and the vast majority of people are low in vitamin D, and so many people are dangerously low, they're deficient in vitamin D, I think that this unwarranted fear of taking too much vitamin D is actually hurting more people than it is helping. And so the solution to this is education. It's information, it's empowering you, and adding some context to these concerns. And so let's dive into a couple things. Okay, so first and foremost, vitamin D falls into the category of fat-soluble vitamins. So there are 4 fat-soluble vitamins: vitamin A, vitamin D, vitamin E, and vitamin K. Okay, so 4 fat-soluble vitamins, A, D, E, K. ADEK is how I remember it. And they are different than what are called water-soluble vitamins. So water-soluble vitamins, if you consume too much, you just excrete it through your waste, primarily through urine. Okay, so like vitamin C, for example, if you intake too much vitamin C, you're just gonna pee it out, all right? Now, fat-soluble vitamins, your body doesn't excrete them the same way, and they can accumulate in your tissues. Fat-soluble vitamins tend to accumulate in your fatty tissues, okay? So in fact, if you consume too much, your body would just kind of continue to collect those in your tissues, and it is possible to take too much and to accumulate too much. But the fear of taking too much vitamin D is grossly exaggerated. And again, I think that fear that has been propagated is causing more harm than it is good. And so let's dive into a couple things. Number one, the general blood level of vitamin D that is considered to be toxic or be a toxicity level is 150 nanograms per milliliter. And if those numbers don't mean anything to you right now, that's okay. Let me kind of explain. The average adult in the US and America has a vitamin D level of 26. Okay, so the average adult is at 26 nanograms per milliliter. 150 is considered toxicity levels, okay? Too much vitamin D in your system at 150 nanograms per milliliter. So that means the average adult would have to increase the amount of vitamin D in their blood by over 5 times, okay? And this doesn't happen kind of by accident or just, someone who is trying to be healthy and they accidentally take an extra capsule of vitamin D at lunch. That is not going to multiply their blood level by 5 times, just one time, okay? Another important facet or thing to think about is it has been established that the optimal range for blood levels of vitamin D is actually between 40 and 60 nanograms per milliliter. And so toxicity, remember, is 150. So even the upper limit of that optimal range is less than you'd have to double that and then some in order to be even close to that toxicity range. So someone who is trying to optimize their vitamin D level, who is working with a doctor who understands vitamin D and is taking a high quality supplement as part of a healthy lifestyle and a healthy diet, their risk of accumulating too much vitamin D is so low that it's almost not worth mentioning, okay? And so, of course, we would never advocate doing anything crazy or radical or extreme, but if you take a reasonable approach to vitamin D supplementation, your risk of overdose is so low, unfathomably low. Okay, now here's another fascinating thing is we don't really have a lot of documented cases of vitamin D toxicity. But most of the cases that we do have tend to be the result of an industrial accident. So on our website, we have a link that goes back to a case study that's really fascinating. So let me tell you about this thing that happened. There was a dairy farm that they had an industrial, like a manufacturing accident. And so the machinery that added vitamin D to the gallons of milk malfunctioned, and it added way too much vitamin D to each gallon of milk. So for context, a typical gallon of milk in the US will be fortified with about 1,600 IU of vitamin D. IU is international units, right? So the average gallon of milk that you buy at the grocery store has about 1,600 IU of vitamin D in it. Well, in this manufacturing accident, the machinery accidentally put in almost 1 million IU of vitamin D, international units, into the gallon of milk. So it's something like 930,000 IU of vitamin D instead of 1,600, right? So I did the math. It's like well over 500 times more vitamin D than was supposed to be put in that gallon of milk. And so this case study, there was 8 individuals who reported themselves to the doctor or the emergency room because they were having symptoms of vitamin D toxicity. And well, no wonder there was almost 1 million IU in that gallon of milk they were drinking. Fascinating thing though is all of them made a full recovery and none of them died. Okay, so when you hear about vitamin D toxicity levels, it's often really extreme, rare situations like a manufacturing accident, or the vitamin D capsule that they thought they were taking. They thought it was a certain dosage, but maybe there was a manufacturing accident and it was like way more than it should have been. Okay, so those are the kind of things that can happen. So the last thing I want to leave you with is this highlights the importance of working with a doctor who is well educated about vitamin D. Okay, not all doctors know a lot about vitamin D, so it's important to find one that does. And it is important to work with the doctor because there are some rare circumstances that can make you more vulnerable to vitamin D toxicity, maybe some medications you might be on, certain situations, so it's always good to rule those out. The other thing is that this highlights the importance of testing, right? Do you want to know how to know if you're taking too much or not taking enough vitamin D? Well, get your blood tested, right? Find out what's your blood level. There's only one way to know if you're anywhere close to a toxicity level, is to get tested. And so then the last thing is connected to that, is you want to make sure that you don't take, if you're about to take a vitamin D test, you want to make sure that you don't take any supplements that have vitamin D in them for about 48 hours before you take the test. This will ensure the most accurate results, as you want to refrain from taking any vitamin D supplement for 2 days before you take the test, so that you will get the most accurate reading of what your blood and tissues actually have in them. Sometimes when patients come back and they tell me, hey, my vitamin D was really high, I ask them, well, did you take a supplement that morning? And they say yes. And it's like, well, we can't really trust that result because it's probably artificially high. So that's an important thing that not everyone knows. All right, guys, I hope this has been helpful. And while it is in fact possible to accumulate and take too much vitamin D, the vast majority of the population has such a low risk of doing that, that fear is actually doing more harm than good. So I hope this has been helpful, and we'll see you next time.